To me, let's go into the final part of this presentation by talking about 4 young women who want to see you. Let's talk about the first woman, Mrs. B, 44 years, young female from Kolkata. She has got gross frequency of urination, she has got urgency, she has got pain on bladder filling, and she has got all kinds of bladder sensations and dyspareunia. Her menstrual periods are regular, and she has been seeing gynecologists in this part of the world. Not only Kolkata, she has traveled across. So she has been treated as recurrent UTI over the past 2 years with our colleagues. She has a normal urinary tract, structurally and functionally. She possibly was not a recurrent UTI. She continued to have symptoms on and off, exacerbated around. Let's go to another scenario to give you an idea about these class of patients who suffered in the past. Miss K, 29 years old, single woman, a cinematographer. She's from Pune. What does she have? She has a gross learned force frequency of approximately 3 years since she remembers. This is a progressive situation where she is forced to go to the water closet or to the toilet, to the loo, because there's a low abdominal discomfort. When your and my bladder fills up, there's no discomfort. We have a frequency, we have an urgency, we feel like excusing ourselves and going to the washroom. But what does she have? She actually has a low abdominal discomfort, a discomfort which says, please go to the washroom, leave everything alone. And this is progressive. She's a young girl, she's only 29. She wakes up at night. You and I also wake up at night, but not with discomfort. She wakes up with discomfort. She passes small amounts. She has got irregular periods and PCOD. All the more reason to see you. And her urine routine and culture has been normal. And she has been treated as recurrent UTI. She has been given antibiotic prophylaxis for what, I'm not sure. She sees you first time as a gynecologist and she comes and sees you. So that's another issue, an era where we treated the wrong reports or the wrong kind of specimens treated and the wrong kind of patients were treated around. Let's look at Mrs. L, a housewife for 54 years from the capital of New Delhi. She has got burning sensations in the introitus. Now, not every burning sensations in the introitus is UTI, please. She's a postmenopausal lady. Estrogenization may be low. She has got increased frequency of micturition for multiple reasons which can happen. But yes, she has got pain when the bladder gets full. She has got pain while traveling on the auto rickshaw on the lumpy, bumpy roads that exists in all the metro cities right now. She describes it as a painful urgency. She gave up all sexual activity, please, because she's so scared. And she's been treated as endometriosis or UTIs by her gynecologist. And she hopes to see you for the first time to look at how it. So she's going through discomfort, pain. You can looking at the ladies at 29, 44, 54, and looking at the last patient who comes from Ahmedabad, who actually had a UTI. Commences as a UTI with dysuria, fever, urgency, hematuria, all those. That means an acute severe UTI 4 years ago, a post-coital phenomenon. But thereafter she reminds herself and says, my pelvis is on fire. I've got menstrual periods which have gone haywire. The coitus is uncomfortable. She voids by day and night, and pre-maturation situation, abdominal pain, all those things are happening around. And she's going to see you tomorrow. So imagine these are the women which have been treated as recurrent UTIs. And they were not recurrent UTIs. Of all that we talked about how to treat recurrent UTIs in immunostimulation, these are different patients around. And I need to remind, because all these patients go to you as my colleague gynecologist respected in the country, and we got to look into these patients too. Because apart from the UTI, which we talk about and treat and possibly mistreat, we actually are letting these patients go through a terrible situation, of a very difficult and unique situation they go through. Variable age groups, presenting as flare, presenting as trouble. And remember the third sentence, we have missed this entire disease, the whole boat in preventing in the era of recurrent UTI. So recurrent UTI was a large subject. We put everybody in the same basket. They had, the age group was from 20s to 60s. All of these patients were female. They had progressive and disabling disease and many treatment modalities now, and they were all women. So we never had guidelines, we never had multidisciplinary teams, we never had therapies, and these were very difficult to treat. These patients are called as interstitial cystitis bladder pain syndrome. Bladder pain syndrome or chronic pelvic pain or pressure discomfort perceived by a patient in the area of urinary bladder and accompanied by one or more symptoms in terms of urge, frequency, urgency is in absence of infection, please. There's no infection here. So therefore there is no UTI. So don't treat such patients as a recurrent UTI. I must tell you, because patients do come being treated as recurrent UTI, but they're actually interstitial cystitis bladder pain syndrome. So I just want to bring light to you on this, because this is from the RCOG journal, which talks about diagnosis of this was always by exclusion. You treat them as the last in the line as pelvic endometriosis, but all these patients have gone through agony and suffering around, which is all about we're getting over endometriosis. So they go through a vicious cycle of epithelial dysfunction, potassium leak, activation of mast cells, pain and discomfort. If that is what it is, you should classify these patients around. All the patients who come to your clinic, if they are recurrent UTI, go to the therapy of immunostimulation. But if they have got pelvic pain, pressure or discomfort, which is as chronic to you and looks like to you as recurrent UTI, look into that do they have urinary frequency, force frequency, urgency, dysuria, and then stratify them into a urine routine and culture and look at, are these patients a case of recurrent UTI or are these patients of painful bladder syndrome or debilitating disease? And to me, we all need to go back and look at our refractory patients who have not got treated. Look at the first, recurrent UTI. If they're recurrent UTI, they need our attention. Our attention is all about treating and probably helping them out. But there's a large subset of patients who probably need to go to the next level. So I was trying to bring you to this very important beyond the horizon concept on the global platform that we have, which we look at from Mumbai. Is all about interstitial cystitis bladder pain syndrome, which again comes on 24th and 25th of August, where you could register and probably come in and probably get this treatment for many patients of that level. So that's where I'm coming to a close at this point. While you cope with a busy gynec practice at this point, I personally feel that this subject belongs to you and should get back to you. You need to take this head on because UTI truly needs your efforts and attention. It probably is no more a taboo. It is treatable and it's completely preventable.